Hello everyone. Just a small note before we start today's video. Make sure you check out the description to learn more about the topic that we're going to talk about today. And enjoy.
Assalamu alaikum everyone, welcome back to another ATP video. Today we'll be talking about a clinically important bug that is often tested in many exams. Please welcome Chlamydia. Chlamydia is an atypical bacterium because it does not stain well with gram stain. This is due to its unique cell wall that lacks muramic acid. Chlamydia has two phases to its life cycle. The first phase happens when the elementary body enters the cell via endocytosis and transforms into reticulate bodies in the endosome. The second phase starts with the replication of reticulate bodies in cells by fission and transformation of reticulate bodies into elementary bodies. Now the cell becomes too full, which results in lysis of endosomes and release of newly formed elementary bodies to exit the cell, where they attach to other cells to start a new cycle. There are three Chlamydia species that are pathogenic to humans: Chlamydia trachomatis, Chlamydophila pneumoniae, and Chlamydophila psittaci. This was a brief introduction about chlamydia. Now let's move on and talk about its important features. Chlamydia is an obligate intracellular coccoid, meaning that it can't make its own ATP, and it's known as energy parasites because it relies on host cells for ATP synthesis. They gram stain poorly, so what do we use to stain them then? We use Giemsa stain, which also can identify Plasmodium, an intracellular protozoa, so it's very good for intracellular structures. Now let us start by talking about Chlamydia trachomatis. Chlamydia trachomatis divides into serotypes. Serotypes A to C are the leading cause of infectious blindness worldwide. Serotypes D to K result in genital infection, infant conjunctivitis, and pneumonia. And lastly, serotypes L1 to L3 cause an infection in lymph nodes, which is known as lymphogranuloma venereum. Serotypes A to C are highly contagious and are transmitted by direct contact, clothes, or insects. These serotypes cause chlamydia conjunctivitis, or trachoma, and untreated infection will result in corneal scarring, which can result in total blindness. Then we have serotypes D to K. They are the most common STI, which are sexually transmitted infections in men and women. In men, it commonly infects the urethra and results in urethritis. Also, it infects the prostate and results in an inflammation known as prostatitis. The patient will present with discharge and dysuria. In women, it causes cervicitis, and this inflammation can progress to PID, which is pelvic inflammatory disease, and it can also cause Fitzhugh-Curtis syndrome. So what is Fitzhugh-Curtis syndrome? Fitzhugh-Curtis syndrome is an inflammation of the liver capsule with adhesion formation resulting in right upper quadrant pain. It's an uncommon, chronic manifestation of pelvic inflammatory disease affecting women of childbearing age. If chlamydia affects a pregnant woman, there's a risk for the infection to be transmitted via vaginal delivery and results in infant conjunctivitis and pneumonia. This occurs when the baby is 4 to 12 weeks old, and the classic feature for this pneumonia is staccato cough. And staccato cough means there is a noisy inspiration between each single cough. Lastly, serotypes L1 to L3 lead to sexually transmitted lymphogranuloma venereum. The disease will present with a primary infection and a secondary one. The primary infection, which happens after approximately 1 week, the patient will present with small, painless genital ulcers, which are herpetiform, that heal spontaneously within a few days. While the secondary infection, which takes place approximately 3 weeks after, the patient will have painful swelling of the lymph nodes in the inguinal region, and they're also known as buboes, with abscess formation and systemic symptoms. The gold standard diagnosis for chlamydia is nucleic acid amplification testing. Culture and staining are not done routinely, but remember that Giemsa stain is very useful for identifying chlamydia. You will see chlamydial inclusion bodies in cytoplasm of epithelial cells. So for the management, we treat Chlamydia trachomatis with antibiotics, and as we have mentioned earlier, the chlamydia lacks muramic acid in its wall, so penicillins are not effective on this bacterium because it's a cell wall inhibitor. Therefore, these infections are treated with antibiotics that inhibit the bacterial protein synthesis, such as macrolides, like azithromycin, or tetracycline, like doxycycline. It has been found that genital infection is frequently associated with a co-infection with Neisseria gonorrhea, so we give ceftriaxone along with the chlamydial regimen. We've discussed everything about chlamydia. Now the question is, how can we prevent it? It can be prevented with regular screening, and avoiding douching, because douching decreases the number of good bacteria in the vagina. Lastly, we'll go briefly over Chlamydophila pneumonia and Chlamydophila psittaci. Chlamydophila pneumonia is transmitted by aerosols. It results in atypical pneumonia, which presents with fever, non-productive cough, headache, and myalgias. The first-line treatment is a macrolide, such as azithromycin and clarithromycin, while the second-line treatment is an oral doxycycline. Now, in regards to Chlamydophila psittaci, it results in psittacosis, which is known as parrot fever. It's a zoonotic infection from birds, and the symptoms of psittacosis can vary greatly. During the acute onset of the infection, the patient usually has flu-like symptoms, especially fever, and they can also get atypical pneumonia with non-productive cough, and they may complain of headaches, arthralgia, and myalgia as well. For treatment, doxycycline is the first line, and macrolides are the second. Please note that the diagnosis for these two species is achieved based on your clinical assessment, which includes taking history and a physical exam, and by using nucleic acid amplification testing and/or chlamydia serology. Alright, to sum up, chlamydia is a gram-negative, atypical, and obligate intracellular bacterium. 3 chlamydia bacteria are pathogenic to humans: Chlamydia trachomatis, Chlamydophila pneumonia, and Chlamydophila psittaci. Chlamydia trachomatis is sexually transmitted and divides into serotypes. A to C cause trachoma, D to K cause genital infection for adults, infant conjunctivitis, and pneumonia. L1 to L3 cause lymphogranuloma venereum. Diagnosis is done by nucleic acid amplification test. Finally, Chlamydia trachomatis is treated with macrolides or tetracyclines. And for Chlamydophila pneumonia, it's treated with oral azithromycin or clarithromycin, and Chlamydophila psittaci is treated with doxycycline. And that's it for chlamydia. We hope you found it beneficial. Don't forget to like, share, and subscribe to receive our latest updates. And as always, thanks for watching.